One of my big inputs was working in the Russian Federation, and one of the achievements was sort of creating what it didn't exist before, and it was a specialty that was family medicine, to see that became possible. It was not easy, because in the time we started working on that process, because the aim of that was reforming the primary care in the Russian Federation, we thought that we should start from the very beginning, and the beginning is having the right professionals to provide the right services in primary care. And that brought us lots of negotiations with the Ministry of Health, and we had to change some legislations and had to convince them that a new curricula it was needed for Russia. We succeeded. We changed some legislations to that, and then is when everything started, because once you've got the legislation approved, then you have to create the real thing. And little by little, we were able to create a curriculum, and more doctors engaged to become family doctors. And then the next step was, where are they going to work, these doctors? And one of the things was, well, they had an old structure of polyclinics with a very isolated way of working, all the professionals, to a more multidisciplinary team of working. That was a challenge, and I think we still haven't succeeded there. But at least we put some of the big starting points for that process to go. That was experience in maybe it was one of the most difficult places to develop a reform of primary care. It depends on the country and the context. This is very important. If I talk about what happened in Russia, the challenges were the lobbies already existing in the Russian Federation. Different bodies, different specialties. They didn't like this intrusive new specialty getting into their field and their spectrum. So that was one of the challenges in Russia. Another challenge is, and I want to move a step forward, is what about the rest of the primary care the workforce? The challenge is nurses and physiotherapists, dentists. Do they feel that they really belong to primary care? What is their role in primary care? And this is one of the challenges we've got now in most of the countries in Europe, to make the rest of the health professionals to become a team, that nobody is on top of the other one. And if I talk about my country, this is one of the achievements that we've done. Working in multidisciplinary teams is a very horizontal organization, that even nurses could be the leads of the primary health centers in Catalonia, and that gives a special role to professions that they are very important and crucial for primary care. The first thing we have to do is listen to the other sectors. So we are not the only sector in the caring system. So I think our approach should be to be open to the social care aspects, and then linking in a very smooth way with other healthcare levels. And this is one thing that for many years from the other sectors or healthcare levels, it hasn't been seen as the primary care being able to provide a very added value. So one thing that we still have to do, first talking, negotiating with the others, and let them know with evidence that what is happening in primary care has good results in health and for the care of the population. This is something that has to be done. Another thing that should be done is lobbying more at the political level. So sessions like that with the summit organized with the minister from Alberta, from the health minister from Alberta, this is crucial for putting the primary health care in the steering wheel of the health system.